Hi, I'm Dr. Mike Yates. This is Tammy. Today we're going to be doing some Botox injections and showing you how we do those. And of course, most people know that Botox is a great way to treat wrinkle lines. I find that sometimes there's a little misunderstanding about Botox, maybe a little fear. After all, it is a poison that paralyzes muscles, right? But Botox is actually a very safe medication that's used both for medical reasons and for cosmetic reasons. And literally millions of injections are done every year for both cosmetic and medical reasons. And it's safe if it's done by a qualified practitioner, that is someone like a plastic surgeon like myself, and of course dermatologists do it as well. So Botox does a great job to help with wrinkle lines. It works good for the frown lines between the eyebrows, the laugh lines at the corners of the eyes, the lines across the forehead. We can even use it down in the chin area to kind of elevate the corners of the mouth and make you look happier. And when you combine it with Juvederm, which is a filler, you get the liquid facelift. So fillers help plump out the nasolabial creases. They can make the lips fuller, lines around the mouth. They can even fill out the grooves underneath the eyes. So Botox plus fillers equals liquid facelift. A great way to get a rejuvenation of the face non-surgically and with no downtime. So Tammy, thank you for being here.
My pleasure.
Okay, so Tammy is interested in Botox for the area between the eyebrows and the corners of the eyes. And so can you frown like we talked? Yeah. So you can see she's got some nice powerful muscles here, so Botox is going to work great for her. And when she smiles, she also creates a few lines there. And we were talking earlier about kind of what you're hoping to accomplish. Would you tell me about that again?
Well, I'm 38 years old now, and while I don't have a lot of wrinkling or deep wrinkles, I do have, I feel, a problem with a droopier brow.
Okay.
I want a little lifted look. And at the corners of my eyes, I do get a little bit of crepiness, and so it just makes me feel like I look angry or tired.
Okay, so really a perfect explanation of why it's good for you, and also how Botox can shape the face. So, you know, we talked about it helping with these frown lines here, but when we inactivate these frown lines, we're also going to get a lifting of the forehead, and the same thing when we go around the corners of the eyes, we get a little lifting out here. So Botox not only helps with lines, but also can shape the face. So we're going to put on some numbing cream, because, you know, most people don't like to be stuck with needles. Of course, you'll see that it's a little tiny needle for Botox, but the numbing cream definitely helps numb up the areas and make it a much more pleasant experience. So Cindy's going to be doing that with the numbing cream for the area, and we'll just show you how that goes on. And so we really put a little coating of numbing cream on here. It takes about 5 or 10 minutes for this to work, so we usually let the patient relax in the chair here, read a magazine, do some emails, and then we get on with the Botox. So we're going to take a little break here while the numbing cream is effective, and we'll join you back in just a minute. Thanks. Okay, we're back. We've let the numbing medicine work. We've wiped it off, and I'm going to put on my funny magnifying glasses, and we're going to go ahead and do some alcohol to make this as sterile as possible. And we're going to go ahead and start the injections in just a second here. Okay, we're about ready to do the injection, so Tammy, you okay?
I'm fine.
All right, good. Now show me again that nice muscle you have there. So you can see how her muscle works, and it's important to know the anatomy of the face when you're doing these injections, so you really get a feel that the muscle's right here. So our Botox injections are going to be to weaken this muscle, and we call that the corrugator muscle. It's what's responsible for these crease lines here, which people call the 11s. And by, again, weakening these muscles, we'll see those lines flatten out and get a little lifting as well. Now, the effect's not immediate. Botox takes about 2 days to really, a week or two to be fully effective. So we're going to just show the technique of the injection today. So again, a little tiny needle, tuberculin needle, and we're going to be doing some injections here. There'll be a little blood as we do this, but usually it's nothing major, and it's nothing that doesn't really respond with just a little pressure. Now, I assume I'm not hurting you too much?
No.
All right, great. So nice little injections here to just go ahead and do the Botox injections. All right, so that's 1/2 of the muscle, and we're going to be going ahead and doing the injections on the other side as well. So show me that frown again. Perfect. So we're going to be inactivating the muscle over here as well. Still doing okay?
I am.
All righty, you're very brave. I do think the numbing cream helps our patients find this to be a much more tolerable experience. Okay, so that's the Botox for the what we call the glabellar frown lines, and you can see that it just a tiny little pinpricks there, and we're going to put a little pressure on there while we move to the other side. Okay, so we've done the frown lines here, and now we're going to go ahead and do what we call the lateral canthal or the laugh line area. And so this will help with crease lines here, which Tammy doesn't have much of those, but also helps with the lift of the forehead. So just a few injections over here as well. And so these help weaken the muscle that kind of squinches the eyelids and also draws the brow downward. So again, just little tiny injections. These don't really hurt the patients too much, and you can see that Tammy's very brave and tolerating this well. Excellent. Okay. Now I'm going to move to the other side. We're going to do a little dance here, and we're going to do the other side as well. Okay. You still good?
I am.
All righty. Here we go. Same thing on this side. Okay, and that's all there is to it. You can see that the injections are just little tiny injections, really no bleeding to speak of there. And this Botox, I think, will really help her achieve her goals here over the period of the next week or two. Okay, so we've finished the injections. You were very brave. You did fantastic. So you can see that we have a few little red spots where we did the injections, but no bruising, no significant swelling. The little pinprick bleeding has stopped. So Tammy should see the results of her Botox probably in about 2 days to 2 weeks is what I tell patients. And for initial patients, I check them back at 2 weeks to make sure they're happy and they have the result we expect. Now, as far as telling her what to do from this point on, we don't like to do a vigorous exercise today. If she wants, she can use some ice packs for the areas, but usually it's not very necessary. She can put her makeup on and go straight back to work or activities. So it's really a fairly simple procedure which gets great results. Thank you so much for today.
Thank you.